Now our cerebellum is an aspect of the brain that actually sits under the cortex behind the midbrain. What that does, it helps control and coordinate all of our motor movements. So how do we keep that healthy to keep the pontomedullary reticular formation healthy? Well, the feedback comes from the eyes, the vestibular area, so that's our balance system, and our feet, okay, the sensation in our feet. Now, if any one of these aren't firing properly, we're going to have poor feedback into the cerebellum, and again, poor sensory in causes poor motor out, so our cerebellum won't be able to coordinate and control all of our movement and motor functions. So there's a couple things that we need to test to figure out if our cerebellum isn't working right. Now, cerebellum, you can think EABC, okay, how we test that. That's eyes, accuracy, balance, and coordination. So that's how we test our cerebellum. So if our cerebellum is off, then we need to go to these areas to figure out why the cerebellum's off, okay? Are your eyes not tracking right? Okay, that could be an issue, you know, causing issues, or maybe you have a large blind spot on one side of the eye, so we can't, you know, we don't have good sensory input coming in through the eyes. You know, do you have macular degeneration? Is it something like that? With our vestibular area, do we have some sort of balance issue? Okay, we have canals in our ears that sense where we are in space, and if one of those canals are off, they'll send poor sensory input from where we are in space into the cerebellum. So sometimes we have to stimulate the vestibular area doing canal exercises to help stimulate the cerebellum to right the pontomedullary reticular formation to help out with blood pressure and pain. Now with our feet, this actually has happened several times. Patients will come in with balance issues, and they've been to other physicians who've been doing vestibular rehab on them, and it doesn't help. Well, that's because they were only looking at the vestibular input into the cerebellum, where if they have peripheral neuropathy, poor sensory input coming in from their legs and feet, then that won't feed right into the cerebellum and cause balance issues. So we have to do our neuropathy program on patients that their cerebellum isn't firing properly, causing balance issues, but it's coming because they can't feel their feet. So when we fire up those large diameter afferents in their feet, then that gives the proper feedback into the cerebellum. So the pontomedullary reticular formation works properly, you have good posture tone, good balance, no pain, normal blood pressure, normal digestion. So it's one big intertwined system, so that's why we're real thorough with our exam and look at all the different longitudinal levels of the lesion.